Hello and welcome. As your wellness guide, our goal is to navigate the path to a long, vibrant, and healthy life. We often place our complete trust in the medical system, believing that every test, scan, and screening is designed to protect us. But what if I told you that for adults over 65, this one-size-fits-all approach to medicine might be flawed? What if some of the most routine tests we undergo are statistically more likely to cause harm than to help? Today, we are discussing a critical topic: overdiagnosis and overtreatment in seniors. We are going to explore the 5 specific medical tests that you have every right, and perhaps even a responsibility, to question after the age of 65. This information isn't meant to replace your doctor's advice, but to empower you to have a more informed conversation with your doctor, focusing on your personal quality of life. The uncomfortable truth is that as we age, our bodies change, and so do the risks and benefits of medical procedures. Let's look at the tests that deserve a second look. First, routine PSA screening for prostate cancer. The PSA, or prostate-specific antigen test, has been a standard for men for decades. But major health organizations, including the U.S. Preventive Services Task Force, now recommend against routine PSA screening for men aged 70 and older. Here is the simple why. After this age, prostate cancer is often incredibly slow-growing. You are far more likely to die with it than from it. The trigger for harm isn't the blood test itself, it's the cascade of events that follows. A slightly elevated PSA test often leads to an invasive biopsy, which carries significant risks of infection, bleeding, and pain. If that biopsy finds a small low-grade cancer, the next step is often aggressive treatment, surgery, or radiation. These treatments have a very high rate of permanent side effects, including incontinence and erectile dysfunction. The data shows that for men over 70, this aggressive treatment does not improve mortality. It does not help you live longer, but it can severely damage your quality of life for the years you have left. The crucial question becomes, is it worth trading your daily comfort and dignity to cure a cancer that was unlikely to ever hurt you? Second, routine colonoscopies. After 75. A colonoscopy is an incredibly valuable screening tool in midlife. It finds and removes polyps before they can become cancerous. However, the risk-benefit calculation changes dramatically as we get older, especially if you have a history of normal, negative colonoscopies. For seniors, particularly those over 75 or with other health conditions, the procedure itself becomes much riskier. The preparation for the test can cause severe dehydration and electrolyte imbalances. More importantly, the risk of serious complications during the procedure, such as bowel perforation, severe bleeding, or complications from anesthesia, increases significantly. These are not minor risks. They can be life-threatening events. If your previous screenings have been clear, your risk of developing a new, aggressive colon cancer that will impact your lifespan is extremely low. You must weigh the high, immediate risk of the procedure against the very low, distant benefit of finding a slow-growing polyp. For many seniors, less invasive stool-based tests may be a much safer and more logical alternative. Third, routine mammography. After 75, this follows the exact same logic as the PSA test. We know that mammograms save lives in younger and middle-aged women, but for women over 75, the evidence of benefit becomes very thin. Like prostate cancer, many breast cancers found in this age group are slow-growing, known as DCIS, or ductal carcinoma in situ, and are not life-threatening. The harm comes from overdiagnosis. The mammogram finds an abnormality, which leads to anxiety, fear, and a cascade of biopsies and treatments. This often involves surgery, radiation, or hormone-blocking therapies, all of which carry significant side effects that can reduce a senior's mobility, strength, and overall quality of life. Studies have shown that for women over 75, aggressive screening and treatment do not lead to longer lives, but they do lead to more medical interventions. The the focus should shift from finding every tiny, slow-growing cancer to maintaining a high-quality, independent life. Fourth, aggressive blood sugar control in the frail elderly. This one may surprise you. If you have type 2 diabetes, you have likely been told to keep your HbA1c, or your average blood sugar, tight and low, often below 7.0. For a healthy 65-year-old, this is sound advice. But for older seniors, particularly those who are frail or have multiple health conditions, this aggressive target is now known to be dangerous. Here is the why. The medications required to force blood sugar that low carry a very high risk of hypoglycemia, a sudden crash in blood sugar. For a senior, hypoglycemia isn't just a moment of feeling dizzy. It is a major medical event that can cause confusion, severe falls, broken hips, and hospitalization. In fact, studies have shown that for frail elderly patients, aggressively low blood sugar targets can increase the risk of death, not decrease it. The very treatment designed to help ends up causing the most harm. Medical guidelines now suggest that a more relaxed HbA1c target, perhaps 7.5 or even 8.0, is much safer and more appropriate for many seniors, prioritizing the prevention of falls over perfect numbers. Fifth, routine. Checkup, CT scans, or full-body scans. You may see advertisements for private clinics offering full-body CT or PET scans to check for cancer, even when you have no symptoms. This may sound like a good idea, but it is one of the most dangerous forms of over-medicalization. These high-radiation scans almost always find something. Our bodies are full of harmless cysts, nodes, and abnormalities that we have lived with for decades. These are called incidental findings. Once found, your doctor is often obligated to investigate them. This triggers a stressful, expensive, and risky cascade of follow-up tests, needle biopsies, and surgeries to investigate something that was, in all likelihood, completely benign. You are exposing yourself to significant radiation and the high risk of a complication from a follow-up procedure, all to find a problem that didn't exist. Unless you have a specific symptom that a doctor needs to investigate, these just-in-case scans are a classic example of creating harm from thin air. So, what do? This brings us to the most important part. How do you protect yourself without ignoring your health? You become an informed partner in your own care. The goal is not to refuse all medical tests. The goal is to ask the right questions. Before agreeing to any routine screening after 65, I want you to ask your doctor these 3 questions. Doctor, given my personal age and my overall health, what is my realistic life expectancy? This is a tough question, but it's essential. If your life expectancy is 10 years or less, most cancer screenings provide almost no benefit because the cancers grow slower than that. If this test finds something, what are the specific risks of the follow-up biopsies and treatments? You need to understand the risk of the cure, not just the disease. What does the evidence really show about this test for someone my age? Ask if there are less invasive alternatives, or if active surveillance, simply watching and waiting, is a reasonable option. True longevity is not just about adding years to your life. It is about adding life to your years. Your health is your own. Be its guardian, be informed, and be empowered. Thank you for joining me today.